How to do disability assessment. The purpose of assessment is to provide services to prevent, treat, and check the worsening of disabilities. Disabilities in leprosy are assessed to know what is the extent of impairments, whether the damage is reversible, what are the requirements to combat and treat the disabilities. Disability grade 1 is defined as sensory loss in palm and or soles. So, sensory loss in a patch is not included in this definition. It manifests in the form of dry skin with loss of sensation in the peripheral parts supplied by affected nerves. Intact sensations are part of natural defensive mechanism. Persons become prone to injuries if this defensive tool sensation is lost. This impairment is scaled as disability grade 1. Disability grade 2 includes all deformities in eyes, hands and feet which are always visible. They may be reversible. Paralytic deformities such as claw hand, foot drop or leg ophthalmos, ulcers and poor vision are included in grade 2 disability. All the peripheral nerves commonly affected are tested on both sides to detect the damage of the sensory and motor functions of the nerve. Eyes, hands and feet, both sides, are graded separately and receive a score of 0, 1 or 2. It is useful to record all 6 scores, but the grade for the person as a whole is the highest score in any of the 6 places. Over the course of treatment, the sum of the 6 grades known as eye, hand and foot or EHF score may be more useful than the maximum grade as it is more sensitive to change. Whenever you find that a person has leprosy, you should record details on the patient's record card or in your clinic record book. You should do this whenever you see the patient during their treatment. This will help you to recognize changes as soon as they appear. Duration of disability noticed by person affected is also recorded. Recent impairments, that is, duration less than 6 months, are known to recover better if treated in time.
Dryness in skin is due to loss of sweating, leading to cracks. If not checked, they will develop into fissures and ulcers. Due to loss of functioning sensory nerve fibers, persons cannot feel pain on injury or feel if something is too hot to handle safely. This is of course a dangerous situation as the person is unable to protect himself. Hence, he is constantly at risk for injuries. In the beginning, when this invisible disability has not yet caused deformity, it is usually neglected. It is our task to inform and teach the patient. He should realize that his affected part is forever prone to injuries and that it needs ongoing protection. To detect risks for injuries, a careful sensory test over at least 2 points in the area of each trunk nerve should be performed. Findings are recorded. Disability grade 1 of recent origin, that is less than 6 months, can be reversed by prednisolone therapy and other measures like splinting the nerve or even surgical decompression. Any person affected is advised and taught to moisten the affected part by just keeping it in clean water for about 30 minutes, at least twice daily. Hereafter, petroleum jelly or edible oil is applied over it to retain the moisture and keep the skin soft and supple. Hand and feet should be protected by using insulated handles, proper footwear and the like. Bites from rats and insects can be prevented by applying a repellent lotion. The affected person needs to learn and adopt self-care practices to prevent more impairments. Grade 2 disabilities are easy to identify because they include all visible deformities. Typical examples are claw hand, drop foot, foot ulcer, leg of thalamus, and blindness. Disabilities like a deformed bridge of the nose and gynecomastia are rare nowadays. If care of paralytic deformities is not taken, it will lead to further damage to the part in the form of muscle wasting and contractures, leading to progressive loss of function of the part. Paralytic deformities are correctable by surgery under certain conditions. The patient must be motivated. Physiotherapy is indispensable before and after the surgery. And last but not the least, prolonged self-care is essential for longer lasting results. Ulcer developed over insensitive skin, especially over the sole, often remains neglected due to the absence of pain. There is a tendency to overlook early signs because they remain somehow hidden under the surface. If not treated, complications like secondary infections and bone damage may develop. Fortunately, nowadays these final stages of destruction are mostly seen among elderly people. Presently, the quality of care has improved and these disastrous outcomes are in most cases prevented. Without proper care, however, the risk of this severe disability remains real. Persons affected by grade 2 disability need to learn simple self-care practices to prevent contracture, muscle wasting and other damage. This other damage includes absorption of bone and tissues as a result of obstructed blood supply and impaired autonomic functions. Referral to a surgeon may be beneficial to assess if the deformities can be corrected by self-care, physiotherapy and surgery. All ulcers can be healed if allowed to heal. This is a very important statement that we should always bear in mind, health workers as well as patients. Fortunately, the healing process is normal in persons affected by leprosy. In order to heal, an ulcer needs a clean cover and rest. Complicated ulcers need to be referred to a surgeon. These are ulcers where also deeper tissues like tendons and bone are involved. We recommend to watch the excellent video that was made by Dr. Hugh Cross on this topic. This video is included on the DVD with lep clips. A person with their eye affected by leg of thalamus, a red eye or blindness should be referred without any delay to the ophthalmic assistant in the primary health center or to an ophthalmologist. If disability grade 2 is left without care, it will get worse. The role of self-care should not be underestimated. Not all grade 2 cases may require surgery, and surgery results are never sustainable without effective self-care.
Disabilities due to leprosy. Always remember, disability grade 1 is defined as sensory loss in palm or and soles. Sensory loss in skin patch is not included in a disability. Disability grade 2 includes visible deformity in eye, hand or foot. Eye, hand and foot on both sides are graded separately and receive a score of 0, 1 or 2. Disability grade of a person as a whole is the highest score in any of the 6 places. Sum of the 6 grades, 2 eyes, 2 hands and 2 feet is known as EHF score, which is more sensitive to change.